Consulate Health Care is one of the leading healthcare service providers to our seniors, and we have over 200 care centers here in the U.S. across 21 states. My role as Chief Information Officer is just to be sure that we're building out the right infrastructure to move us into the next decade where we're having so many changes in our industry specifically. Whatever infrastructure we build, we need to build that across our entire enterprise. And in order to be ready to employ things like electronic health records and other emergent technologies in telemedicine, the infrastructure that's the most important is how are we going to keep all of these endpoints connected. Aruba is our chosen partner for the wireless infrastructure as well as the applications that manage all of the endpoints that are going to be coming into play over the next 3 or 4 years. The first tier of that platform is that it's got to be stable. And that's one of the stigmas with wireless, is that if you don't have a stable platform and there are connectivity issues, your users are going to be up in arms. And when our users number in the tens of thousands, we cannot possibly afford to have a network that's not stable. The next piece, of course, is security. You know, we've got 3 core business drivers. We have to make sure that we are continually improving the continuum of care, and we have to make sure that we are striving for better clinical measures, and then the last thing is we've got to make sure that we're protecting our patients' health data. And this tiered platform that Aruba is building, and it demonstrates itself through ClearPass and Airwave, these are the tools that I think are going to be able to get us to where we need to be in order to tackle those challenges. As an IT group, we started with Link. We were kind of the guinea pigs. We wanted to test it out, see if it made it easier to collaborate, and Link was great for that. We were able to do video conferencing. Of course, it's great to be able to ping somebody that may be on the other side of the building. It was a very smooth rollout to go from IT to the corporate as a whole, so we've been very pleased with how that's gone. There are endpoints that are owned by Consulate, there are endpoints that are BYOD, our practitioners bring them in, and no matter what the device is, it needs to be able to securely and efficiently connect to the network the first time, every time. And so that's where I think that the Aruba solution has been so powerful, is through Airwave and ClearPass we have the ability to make it as seamless as possible for a practitioner to walk into our building and immediately begin giving care to that patient.